Meeting is now streaming live.
We're live. We are live. Let me get my volume down up here. Get my beautiful, beautiful. There we go. Get my phone set up. What's up, bro?
Nothing much, man. Yeah.
Happy day after New Year's Day.
We still get some Lolos popping fireworks.
Yep, that's gonna go on for a while.
Is it still running live? Do we know? Does it show?
What? You mean our show?
Yeah.
Oh yeah, it's live.
Okay.
It is very live. Happy Saturday night, Sam. That's right. So nice Saturday night.
Yeah.
It's kind of I don't know, man. It's like I don't know. It's just different, but it's 2021. Numbers climbing. Um, that's one of the things we caution people that everybody will say we can't wait to get out of 2020. 20. Well, we did. We got, but 2021 we still got this virus to battle. We still got this virus to beat, and it's still going to take some time. It's going to take some time. It's going to take some action on our part, on our leaders' part, and we got the new variant running around, which is why we invited Dr. Miscovich to come on to share a little bit, um, some factual data information about the variant, this highly contagious variant, because a lot of people has been talking about it. And I saw your post, Charlie, today, and
Hmm.
I cannot agree with it more, regarding the people that are still gathering, still partying, still ignoring the fact uh, that this thing is not gone. It's still here, and it's picking up steam again. But we've seen the numbers from Christmas. Uh, Man, I'm afraid to even think about what's going to happen with the New Year's numbers when that comes in the next week or two.
What bothers me, and I'm sorry, I had a really good and delicious garlic sausage today for lunch.
Mm.
Uh, just a little kitchen. Of course, my lovely wife, she makes like a banh mi sandwich. Not a Vietnamese sandwich, banh mi. You put the pickled vegetables on top, or she puts a pickled vegetables with her mustard and all that on the sausage, and puts all the pickled vegetables in the pan. And whew, she makes it look so ono. But anyway, um, what what's sort of getting to me is the fact that today I was so wrenched and so saddened by, and I don't know why people think it's fake, but you look at these on your syndicated channels, your mainland channels, and you look at these nurses tired, get rings around their face from the N95 meds. They're pleading with people, and these nurses, both male and female, are saying that now some of them are required to work 24-hour shifts. How can anybody be efficient after 18 hours? You're in a ICU unit, 24 hours, and someone's life depends on you pushing all the right buttons should something happen, and yet they're pleading. This is, please, we don't have much room. I mean, some of it they've converted their gift shop into a treating, like an ER treating room. I mean, how is that? And it's because people, it, I was watching about Europe as well, and not to go on a tangent here, but we worry so much about our rights, our rights, our rights, and yet that's the very thing that's preventing us from beating this virus. And
Mhm.
yet, it is European countries that their leaders are saying, "Hey, you will do this, you will do that," and they've come down and they clamored it, they put a halt to it real fast. And yes, it goes back and forth, but they have proven methods that stop it. But if we do it here, somebody's gonna yell that their rights been violated and blah 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 blah. And I said, and that's what my post was. As long as you folks keep on doing all the bad habits, all you're doing is breathing life into this virus. You're the ones that keeping it alive. I want this thing to be dead and gone. And if it means I gotta sacrifice to make that happen, I will do it. But for those of you out there that feel like, no, I got my rights, then you know what? When you grumble, you don't want job, you don't want money, is because you're breathing life into this damn virus that's causing this mess. Think about it.
Yeah. I saw today in California, the funeral homes are at capacity. They don't have room, and when you look at our numbers now, 241, Kauai had five today, five, all travel related. Um, this thing is heading the wrong way. And I saw lots of party pics from the New Year's, lots of party pics. I see retirement party pics from work, coworkers sitting at lunch. I see all these pics about people
Mhm.
just taking this virus so lightly.
Yeah.
I don't like where we're headed, Charlie. I do not like where we're headed. And, you know, it's people complain when bad things happen. People complain when restrictions get put into place. They don't follow them. I don't know why you complain. If you're not following them, why complain? If you're following the restrictions and it's causing a damper on your life, then fine, complain all you want. But if you're not following them, why the hell you complain and be angry? You're not listening anyway. And people posting, I just see Marie posted what I'm thinking about. They keep talking about this 99% survival rate. They, don't- they they're not. It's ridiculous to even go down that. I'm not even going to debate. I'm not even going to debate with people like that because no sense, because they don't know. They haven't met people like we have on our show. They haven't met the survivors. They haven't recovered, and they probably will never recover 100%.
You,
So,
you want to hear? You want to hear something that's really absurd? A doctor says we have probably 10 more beds in the ICU left. Okay, he's in California. He says this today, and he says, we can get them through the ER, and we'll probably catch them early, and we can get them from the ER into a floor, not an ICU, but a regular floor, and hopefully they can, we can get them. He says because you know that if we get them on the ventilator, we're talking about weeks till the person dies. I mean, he's calling it straight. He says it's weeks until someone dies once they get on the ventilator. And so he says, but here's the thing: we can get them onto the floors, but then a lot of people out there think once we discharge them, they're all good, fine and dandy. No, from there they go to skilled nursing. Now, skilled nursing doesn't have room. Skilled nursing doesn't have enough nurses to staff the skilled nursing areas or the skilled nursing homes away from the hospital to help these people who will definitely have some issues because of COVID. There's always there's something always attached. But these people, they're very short-sighted. That's why I always say, hey, bro, you can walk down the street. Try not look just to the tip of your nose. Try look far ahead because something a big puka's in the ground. If you're not careful, you're gonna fall inside a puka. And some people are just not like he that one.
yeah, that's that young congressperson or senator that died or the senator elect, I guess, that died on Illinois or Indiana, wherever it was.
Louisiana.
He wasn't very a strong advocate for the safety rules for COVID. He's dead now. He died of COVID.
Yep.
So, until it happens to you or someone you know or love, then maybe you look at this with a different perspective. But until that happens, I think it's very easy. And I know the mayor just had the governor approve two different measures for the safe travel. So now mainland visitors can come in, quarantine in a resort bubble for 3 days. If they test negative, then they can break their quarantine or get off quarantine. Inter-island travelers, as long as you take your test 72 hours before you depart, and you get your result, then you can come to the neighbor island, to Kauai from the neighbor islands without quarantine. Now, all of this was being done and submitted to the governor before the increase in numbers on Kauai. So I don't know what's going through our mayor's head right now. Now that in fact we're starting to see, hopefully today's numbers were an anomaly and it's not something. I just have a really bad feeling that people are traveling, people are picking up viruses elsewhere and bringing them home. So yes, we are quite concerned, and it was because of the backlash that a lot of people put on our mayor about why you went to the 14 days. You're killing the economy. You're killing it. Now what? Okay, so you relax a little bit, and when the numbers increase, what then? What then? What will the argument be? What then? What when we shut down again because we cannot control the numbers? Then what? Again, this up, open, shut, relax, get tight, relax, get tight. It doesn't help anybody. It doesn't help anybody. So anyway,
Yes, you're absolutely right, my friend.
it's so frustrating because we're in this together. We gotta respect what the rules and regulations are, and if we don't, people will die. That's the unfortunate reality of where we're at today. So anyway, Dr. Miscovich, Dr. Scott Miscovich is back with us.
How's it going?
It looks like you're in Hawaii.
Yes, I am. I'm home.
All right. Share, guys. Share. Everybody share. Everybody hit the share button.
Yeah. Happy
Roger.
New Year. Happy New Year.
Happy New Year, guys. I'm at home, and I've got my whole family home and others. So I'm in a different spot than where I usually talk to you guys from because every room is occupied and I've got people somewhere. So if you see animals coming by or hear any kind of weird noises, it's because I got a house full.
Okay.
All right. Well, thank you for agreeing to come on tonight. We appreciate you here. There's a lot of talk, a lot of concern, a lot of questions about the new variant. But it's been a while since you've been on, Doc. So maybe we can start off by the way, this is Dr. Miscovich, Premier Medical Group. Is his practice, and he's been kind of like the leader in testing. He's kind of the innovator, the leader, the guru. I don't know what else. I think he's tested more people in our state and probably in the mainland now than anyone else I know. So, Doc, with that, why don't we just turn it over and bring us up to today in the life and times of Dr. Miscovich.
Wow. Okay. Well, I have, our Premier Medical Group, which is our medical practices here, which has about 140 employees and about 25 medical providers on Oahu and here. And then that has launched us into Premier Medical Group USA. So I now have 600 employees on the mainland, and we have now done 1.4 million COVID tests. So it's been quite a ride since I've last left you guys. I think, as you're aware of, one of the things that happened was I wrote and designed the return to sports for the SEC, and proud to say we have one of the SEC members will play for the championship, the perennial college football powerhouse Alabama. But I've had teams of individuals testing throughout the SEC, about 150 people throughout the southern states. I've been down there all over the South, driving from campus to campus. We're also in a lot of the universities testing the student bodies also. And in some cases, we're testing within the surrounding communities. Then my group was asked to test Disney. So we're doing all the Disney film studios, and that's in Atlanta and LA. Probably have about 150 members of Premier USA working in those two cities. So they're keeping the movie studios going and working really closely right now. We will probably have teams doing 4 states for the Navajo Nation. We're also going to be reaching out. We've been asked to address the Hopi tribe also. So that's something very close to me, with what I've done for our Pacific Island populations. And I could reel off a whole bunch of, we also just have been asked to do a significant portion of Arizona to do all their vaccine administration. I have about 10 or so projects that are pending for vaccine administration. And then closer to home here, we have continued to do every day. We're probably doing, and if you look at the total number of tests that are being done, our premier group is probably doing half of them in the state and continues to do about half of them. Like right now, I have every day 1 to 2 to 3 teams here on Oahu doing nursing homes and businesses. So we've had a real big focus on conjugate living facilities and nursing homes. And then I think something we should talk about with a little bit of pride is the programs we've been running now, and I've been back now for a while, and I probably have spent about 3 to 4 weeks of the last 6 to 7 weeks over on the Big Island, and I was working with then Mayor Kim quite a lot over the last 3 to 4 months, and now we've transitioned over to new Mayor Mitch Roth, and we have a very comprehensive program that we're working on the Big Island that I think we need to be talking about as a model for the rest of the state, and actually some of the other areas are trying to look at it. And I'm not sure if you guys are following our numbers over in the Big Island, but yeah, I think we had 20 today. We had 12 or 13 or something yesterday, but then it was 2, 2, 3, 4, 2, 5. Our numbers are quite low, but at the same time, we've opened up tourism completely over there, and there's a couple thousand people a day, 2,000-3,000 a day that are coming, and we're starting to see our hotels fill up. And we're doing it with a 4-step program. And the 4 steps I think are simple that we need to kind of think about how we're going to move forward, especially like in Kauai. I know you guys are really taking the front line for trying to keep Kauai safe. So with the 4 points of the testing, our number 1 is static testing. So having regular testing available for the community in very accessible sites, drive-in, drive-through testing. We have Hilo and Kona and one other major location on the Big Island. Number 2 is that we have, we have the arrival testing. We're testing every single person that gets off a plane with rapid antigen, and that has gone very, very well. Even though they're getting their 3-day prior, that next test, we are getting positives that are significant, and it's a big part of it. Number 3 is we're doing regular testing at the conjugate housing and at what we would call the high risk areas. We're going in on a regular basis to the high risk communities, the public housing areas that have shown clusters before, and we want to keep up with those areas. And then number 4, we have mobile vans that I have staffed with 6 people. We have 3 teams, and they are our strike team. So if there is a positive, even if it's 2 to 3 people, we have those teams in within 12 hours, and we begin a regular cadence of strike team testing so that we can address a cluster before it gets out of control. And so I think the combination of having all that testing available has allowed there to be, an open island now with tourism, and a lot of confidence, I think, by the individuals living, a lot of support from the visitors industry. And then we have a really good partnership working with civil defense, airport, the mayor, and all the community providers. And, I have about 120 premier medical group providers over there that are doing this at the same time. So that's, I could talk a lot more. That's kind of a high overview of what's going on as we're moving into vaccine right now with our group also, but testing is going to be key still for the next 6 months.
I wanted to ask you, we definitely want to talk about the variant a little later, but I wanted to ask you what your thoughts were, because you did mention Kauai, and that in fact, Kauai, we took some extreme measures, but why was Kauai different? Why was Kauai, in your opinion, when all the cases, once we opened up and all of our cases, the vast majority of our cases were travel related, was either people that didn't have their results from their pre-tests and got their results while they were on Kauai and it was positive, or visitors got sick, went to the doctors, went to ER or urgent care, got tested and was positive. Why was Kauai so different in the proportions of positive visitors or travel related cases than the other islands? Do you have any idea?
No, I really don't. And I have to tell you, I'm kind of surprised about that. And because one of the things, I'm following obviously every single thing that all the medical community has done over there and across the state, and I'm working up with, the Department of Health, and we're now in a very positive communication. Hey, by the way, man, I like that. I like that glass that you have there. So,
Cheers.
cheers. Cheers. Um, and so there's a lot of communication, a lot of sharing of information. And here's a point that I wanted to throw out to you guys that I don't know if I'm hearing said enough, because I know there were a lot of people that were kind of coming out and spewing a lot of statistics and trying to say, oh, the pre-test won't do this, and then we need, the two tests afterwards. And, I was very much saying in a perfect world, you would have, the two tests and the 7-day separation and the quarantine for 4 days. Totally understand where Kauai is going and what they've just gotten approved now through the governor. On the other hand, there was a variable, as Mayor Kim made a move. So it was on the 13th, we finally got the approval of October from the governor, and they had 2 days, had 36 hours to pop up an entire airport testing program. And kudos to the teamwork that put it together, had to pull 50 employees over there at one time. And here was the variable that I think is not spoken enough. It's the people who go to each island. It is a complete different demographic, the type of visitor that comes to the Big Island. But I thought that the demographic of our Big Island and Kauai would be very similar, because I think there are a lot of people that come to those two islands because they're not Maui and they're not Oahu, and they're looking for what the islands have, all the rural beauty, all the separation, all the hiking. There's no big major area where you have to go and congregate like you might have with the Mauis and the especially Oahu. And I was on the front lines over there, guys. We've done, I don't know, 60, 70,000 people. And I was over there right at the front line. And the way I worked, especially early on, is I talked to the visitors. I went and I just talked to these people. And there were a couple of questions I was asking, hey, welcome to the Big Island. Why are you here? It's certain things, just like we all know. They were trying to get away. People wanted to go to a place that was safe. Hawaii was showing itself to be safe. And they liked the concept of testing. You cannot believe how positive it was. It was a positive that they got tested at the airport. It made them feel safer about the destination. We have those people through in 20 minutes. They're probably barely longer than their bags take. And so the people then went and enjoyed the outdoors. There wasn't, then when you went downtown, the Big Island had the highest mask use, and there was a lot of understanding in the restaurants. There was this whole communal feel in the island that we were going to share it, and the people shared it. And I thought Kauai had the same opportunity, because there's no doubt, I think the people that seek out Kauai seek out the same thing. The beauty, the isolation. They don't want to be in sitting in a bunch of bars drinking with, 200 people every night. Maybe a few do, but they're looking for the beauty and separation that the garden now offers. So that is something that was surprising to me. And, I don't know. I think that when you look at the total percentages of the number of people we've had in, we have some of the best data in the world right now for arrival testing, because we're doing it at the airports and we've already been asked to publish it. The percentages of positives are very low. and then the number of positive visitors that subsequently convert to positive while they're on the island is minuscule. It's minuscule. And part of it might be that they know they're getting tested when they walk on that island. So if they're even having any kind of illness symptoms, they don't show up. They don't come because they know they're going to be, the last thing people want to do is get stuck in 14 days of quarantine. So Mel, that's the best I can do. It's the selection of the type of individuals who I looked at in the face, hundreds and hundreds all the time. And you combine it with the arrival testing, and what these people are seeking is peace and safety. So that's what my best guess is.
Yeah, I was just surprised because we track the numbers daily, and it was so different. Kauai was so different, and and so it put our mayor in a very difficult spot, and we couldn't get the approval for the second test after a short quarantine. So yeah, I just put him in a tough spot, and I still trying to figure out, and no one can answer that question. Why are our numbers? Why are we having all the travel related positives and no one else is? It's just bizarre.
What was your total number that you guys, since you guys have your pulse on it, how many did you have when you guys were open at the beginning that were travel related? And
oh gosh, I'd have to go back and check. Honest, I should have.
Was it a 64 number?
I think we had more travel related cases in that first couple of weeks than we did active cases pre October 15. It was
right.
remarkable.
Right.
Remarkable.
And then were they travelers, were they residents returning back, or were they visitors that were trying to come and enjoy Kauai?
The majority were visitors. The majority were visitors coming in. Again, a lot of them were the tests that they couldn't get the result before they left, and they got the results after their arrival, and it was positive. And like I said, some got sick. So
well, there is your problem right there. I mean, that was a problem in the process. That doesn't happen right now. You can't, you basically will have to quarantine. I mean, so that is a loophole that has been closed in the whole process, that you can't come on island and then go to quarantine and get tested and test out. Can't do that anymore.
Right.
And then the second issue is that if you have a test and you're from the mainland and your test is pending, if you show up without a test result, you're quarantined for 14 days, right? You do not get released. And so that was a loophole. And then now we do have a loophole a little bit with the inter-island travel, which is if you have a pending test, then you can do the neighbor island until the test comes up. But from the mainland, that loophole is closed. I've always had an issue with one issue, and that was all of the broad number of people that were getting exemptions. I think that basically, I don't care what your role is, how important you are, etc. You need to have your pre-test. That's it. I mean, when you look at the huge number of people who would get exemptions from, being essential workers or whatever, I found in all the testing, again, and I think it's really clear at Premier, we have the largest database of testing in the entire state by a long shot, that a lot of those people were the ones that were converting over to positive, especially early on. That's where our positives were people coming back from the mainland, people that were working, the work gets closed down, they come back home, they're positive. Man, I saw that all the time. So.
Hey, Doc, on the Big Island, who pays for that test? Who pays for the rapid antigen test?
Boy, it's an interesting question. Originally, Mayor Kim had set aside CARES Act money for it, so it was being paid for the county by the CARES Act. And then, as of about the 15th of December, the well ran dry. And so we have a private benefactor who has basically contributed $1 million to run it through December 15th to January 15th. And then I'm putting up another 400,000. So I'm funding a large portion of it. And probably it's going to turn out to be almost $500,000 that I'm going to be committed to. And not that I'm not that wealthy, guys, but I committed that I was going to run this test. And we did not have any idea when I committed to this that we were going to have our numbers double. We were doing 700, 800, 900 tests. Now we're doing 2,000. So our numbers doubled over the holidays. Should have known. And then Madame Pele just joined in and said, hey, why don't I join this parade and make a lot more people come over there? So the Big Island is booming right now. And I committed to run all the testing with this benefactor. And so, we're hoping that now that there's going to be more funding coming through, that the county will pick up more of the funding again, because relative to the cost of the return, I think it's a huge return for what we're getting and the number of positives we're finding.
So, it almost seems at this point with rapid antigen test that's been allowed for the Big Island that you're using, it's not the gold standard, the PCR. You're doing just the rapid
Mhm,
antigen, right?
mhm.
Um, why do you think, and this is just an off the cuff question, why do you think the governor is opposed to just letting the visitor pay for the test? Is that
I,
right?
I don't know. I don't know. It doesn't make any sense because from my perspective, there's a lot of countries, if you look around, because I pulse all the countries around the world and what they're doing. And a lot of them are basically telling the visitor, you got to buy insurance, you got to pay for your test, you got to pay for quarantine. I mean, we're being really nice. We're being really nice to our visitors. And from my perspective, to add a little bit of an extra cost on for something like that probably is okay. It's not that expensive. So
Because, if you think about it, a lot of times, I mean, as a local traveling to another island, whether we use it or not, we pay a resort fee.
sure.
The places like, I mean, I don't want to use the term dump, but even if it's like a dump, you're gonna pay some kind of fee, whether there's no parking there for only valet, whether you valet park or not. It's all incorporated. So I just couldn't understand why there's this block. And secondly, you mentioned that on the Big Island, I guess some of the tests, if a tourist knows that, there's a possibility they might get a positive, that's why they don't show up for testing. Um, it sounds to me like it's on a voluntary basis. So,
Mm.
so
No, no, it's mandatory. No, this isn't voluntary. Basically, you get off the plane and
yeah,
you come through safe travel. And as soon as you come through safe travel, you're coming through a second level of testing. And if you don't do the testing, welcome to 14 days of quarantine.
okay,
So no, we are getting basically 100%. We are not getting people. I'm sure there's got to be a few, but the bottom line is no, we're getting 100%. There was a little period of time where we had a 20%, 25%. We dropped from 100 to 25, where there was some question about the funding. But then when the mayor looked at the positives that we were picking up, this is Mayor Kim, he was like, "There's no way this program is successful," and he then geared more funding towards it. And it was only about 10 days, we went down to 25%. So now we've been up to 100% for quite a period of time, especially during the peak. And sure enough, what does the number show of the number of positives? Just as you'd expect. As Los Angeles, West Coast, Arizona, those numbers are surging. Guess what? The numbers we're picking up as people walk through getting tested, it's showing that we're picking them up. And then we have a good partnership with Department of Health, because basically we're handing them right off to Department of Health and they're going to quarantine, and they're going into one of the quarantine hotels we set up. So and the visitors industry, is a very good partnership around the island. Everybody is like really pleased that it's going on right now, especially right now. Think about it, guys. This is the peak. We are about to enter the darkest days in America when it comes to the pandemic. When you start looking at the numbers, and you can see these from the University of Washington statistics, we are going to be seeing some very steep rises in the number of deaths across the country. So, uh, once we get into the 20s of January and go through the month of February, just watch out for the hospitals, and these people are still going to come to escape it. And that is the most important time. We need to be doing all the testing we can to identify people that may be positive.
So, Doc, what happens on the Big Island? I totally forgot about the Big Island testing, but so a traveler comes in, they already had their pre-test, they had a negative result, otherwise they go straight to quarantine. So they're coming in, they have a negative test, they do the mandatory testing at the airport. What happens if that antigen test comes back positive?
If the antigen test comes back positive, we immediately do another PCR on site. They are sent to their hotel. Department of Health is notified. They're allowed to quarantine in their hotel. Those are turned over in 12 hours, 20, no more than 16. We're working closely with clinical labs of Hawaii, and then they get their result right away. There are some false positives, but you know what? The person slept overnight, they get the result the next day, maybe just after lunch, and they're free to go. If it's positive, then they are greeted by the Department of Health and taken to the quarantine hotel. So with antigen, remember, it's a screening test. We have results in 15 minutes, but it is still, we're seeing very good results from the machines we're using. We're using the equipment called BD, which is Quidel and BD are the top national, Quidel and BD are the two manufacturers I work with. They are the ones that when the federal government said, we're gonna save nursing homes, and they bought out all the supplies of Quidel and BD. They're both large US-based companies, have been around for 30 years, then they've been in the medical machine, laboratory world, versus there's a lot of these little birth control kits and all these little pop-ups and stuff. They're not of the quality, and that was shown by the government buying out the inventory for all the nursing homes. So these are being used across the country. But 15 minutes and excellent results right now.
Do you, by any chance, have the numbers of how many of those tests come back? What percentage of the passengers are testing positive on the antigen? I'm curious to know how accurate, after the positives from the antigen, how many of them remain positive, or how many are actually shown to be false?
Actually, there's a person who's smiling right now about this, and it's the good old Lieutenant Governor, because it's about 2%. So we're getting, he was saying beforehand with his numbers, we're going to get 2%, but we're getting anywhere from 1% to 2% that will come back as positive. A lot of times it's less than that, but yeah, we're getting more than enough positives to justify the cost, the expense, and the timing, because when you do that R0, that contagious factor of how many people those people will spread it to on the island, we're saving, 300-400 infections on the island per month just by doing the pre-arrival test with the numbers. And we've shared these with DeWolf Miller, who is the epidemiologist who's doing the data. And I just shared him numbers yesterday, which were the December's close. And again, we're really, again, statistically depending. Now there's some variability on the statistical analysis, because it depends on what the current positivity rate is, what the contagious rate is at the time, which then dictates how many people that will potentially get infected by every individual. But we're probably seeing quite a bit, 300 to 400, and since it's in a tourism setting, close contact, it could even be higher. And I know we're going to talk about it, but that kind of is one of the dovetails into the new variant, because as we see that variant being upwards of 70% more contagious, that means the number of people who can get the disease from one positive individual who's carrying the new variant just broadens even more. So it's going to even make it more important that we try to identify any individual that comes to our state who is positive with the new variant, because guys, the new variant, it's going to be everywhere. It's going to be all over the country. There's, we can't deny it. It's going to be around. It's going to spread rapidly.
I know Charlie has a question on a variant, but I had just one clarification. Okay, so 2% of the arrivals, that's the number, but out of the
less than 2,
okay.
Maybe the maximum time it would be. It goes from probably about 0.5% to maybe about 1.4 to 1.5. Occasionally it will hit 2, but it's probably closer to 1. Yeah.
I really wish we would have done, or was, again, this Kauai number is kind of baffled me as it's so different. But the question I was curious about was, out of every 100 tests, that 100 positive tests on the antigen, what percentage after they take the PCR is actually positive?
I can get you exact numbers, but it's close to half. So there is some false positives in the rapids when you're doing such a large number. But relative to the numbers and the speed of the test and the inconvenience, it's not been a problem. But it's about half. So
About half of them show up to be false positives.
false positive, yeah. So, and relative to what we're dealing with, since this is an asymptomatic population, we're fine with it. You know, we're only expanding the use of it across areas. As a matter of fact, I'm talking to Atlanta Hartsfield right now about actually doing some things. I have a big call with them tomorrow or Monday. Today's Saturday. Yeah.
You know, there's this situation, Brian, that, you know, sort of kind of I wanted to ask you, Doc, and that is one, when we know that the variant is out there, so just keep that in mind for now. Like you said, the variant is it's gonna come. It just we don't know when. It may be here already. So I'm pretty sure that the state is already set up to start testing for that, right? In some way or another, those positive cases to determine if it's a variant or not. Correct?
First, I would like to give a shout out, you know, because you guys know I've been a vocal critic. You know, I'm just straight. If someone's doing something, I'm going to be straight. I want to give a positive shout out. Ed Desmond, the head of our lab, he is all geared up. He is testing right away. The number of samples he's testing is very significant. So we are already at our State Department of Health lab testing for the B117 variant, which is the main variant that we're looking for. Now, one of the things I'll tell you guys, it just kind of really pisses me off, to say the least, is we're sitting here and we've got this variant that's cooking over in southern UK, in just south of London. And it's been there since September and it keeps brewing up and now it's spreading all over. And if you look at the data out of the United Kingdom, this has been exploding over there. I mean, the data, it's just going, and they're testing for variants in 40, 50% of every one of their positives. They're then looking for the variant and they've had the data watching these variants. And what are we doing in the United States? Okay, just this week, we have what, 330 million people. Just this week, the CDC said, we're going to start testing 750 samples a week. A week. Think about that. And we're just starting it today. Now that's a failure. How did we let that? And guess what? I was on, I don't know, a couple times ago when I was on CNN, they played this piece where the Governor Cuomo from New York was talking about the travesty of how he wants to shut down all tourism from the UK because he's like, we're letting people coming in from the UK, no test whatsoever. And I'm looking at myself, well, whose fault's that? Why don't you let these people get a pre-arrival test? Well, and that's actually what I said on the CNN interview. I said, you know, we're doing this in Hawaii with pre-arrival. I disagree with Governor Cuomo that shutting it down isn't going to make a difference because you would have had to do that 2 months ago with the number of people that come from the United Kingdom into New York or LA. It's everywhere already. And, you know, our CDC failed us with this and you know that when it comes to the number of variants per capita, we are 43rd. They're testing more for variants in Ghana than we are in the United States. We're 43rd in the tests that we are running to look at the genetic variation of COVID. That's abhorrent in my mind, knowing how long this has been around and knowing that this is not the last time we're going to see this. So, you know, here's a good example where kudos to Ed and DOH, heck with them. Let's just do it on our own and let's just check for it. So, you know.
So the variant, as I understand it, and correct me, first let's just look at the standard strain. It's been recommended that cumulative time of contact 15 minutes, right? There's
Mhm.
a possibility you can get infected with this variant because it's highly contagious by 70 plus percent. Does it mean that the time of contact is reduced greatly? And is it, if it's so highly contagious, can someone actually get uh, infected pretty much in close quarters just by passing? It's if it or how does it work
Mm.
when we're talking about something that's very contagious?
Okay, so there's at least 17 variants that have been found genetically on this new, and some of the new reports are saying it could be up to 23 variants. Now, to give you an idea, a normal kind of variant or minor mutation that occurs in a virus is usually one or two. So to have 17 at the same time is just baffling. It's just like, how did that happen in such a quick period of time? So that is a big concern right there. That's a major concern. Now, at least 8 of those variants have been found to be on the spikes. So you've seen the pictures of what that beast looks like. It's got all those little spikes. Those spikes then have to find a receptor, a specific receptor, suck on, and then inject the protein in to start the replication process. So, as it did in one of the other G variants we had earlier, those spikes have become stronger. The cups, the adherence has become major, right? It's become really, really much more adherent than it was in its prior variation. So, what that means is you need less of those little viral particles to get into your mucosa or oral mucosa and latch on. Then before, you need a pretty good breath of them because a lot of them were just kind of breaking away and falling away and just kind of crumbling away. So each one is just kind of like a super juggernaut now compared, at least, almost coming up on double the strength, 70%. So therefore, the other thing we're finding with the new variant is the ability to culture it now in the oral and nasal mucosa is very significant. So what that means is those smaller variants are hitting into your oral nasal, and then they're doing a lot of their spreading there. They don't have to get back into the deep mucosa or get down into your lungs to create the disease. Whereas before, a lot of times we were thinking you were breathing it in or it was getting into your system. So technically, Charlie, you're probably saying the right thing. It doesn't take as many of those little viral particles to enter and latch on to create an infection. So is it a walk by? Don't know, but I think I mentioned that on one of my TV appearances. We should be really considering if you're close contact, and think about it, guys, 6 feet. 6 feet. One of the things I want to tell the listeners to do or viewers to do is I think everybody should get used to measuring their wingspan, right? We should all take a tape measure and measure your wingspan. So if you don't know, everybody knows their body height, but see what your wingspan is to really get an idea of what 6 feet is. And I'm telling my family, kids, family members, everybody I can talk to, push it out to 8 or 10 feet if you can, push it out if you can. And in my mind, if we're think about 6 feet for 5 minutes, that means if you're talking to someone and you're there for 5 minutes and you have this new variant, I think you're in trouble. So I will basically be talking about close contact at a much lower period than 15 minutes. And I will challenge the CDC to get off their cans and to start making those assessments now instead of waiting 2 months from now and say, this one's a little more contagious, so you might want to spread out a little bit more. Come on, it's common sense, right? It's total common sense. Spread out a little bit more, while this new variant is going around, and wear your masks. And that's what I basically said on all my recent TV appearances. Everybody's saying, well, what can we do? Should we shut down? You want to live under your stairs or something? Well, I guess you can, but the bottom line is we got to do what we've been doing. Wear your masks, be a little more cognizant, spread out a little bit more. And in the state of Hawaii, outdoors is fabulous, right? We have a blessing here, which is one of the things that's been very helpful. And don't sit in a low ceiling place with a bunch of people around the table with no ventilation. That's asking for all 8 people at that table to get it. That's just not what you should be doing right now if you want to be doing everything you can. And then the final thing, I've been saying this forever, especially over the holidays, is we all have fans in Hawaii. Put a fan behind you, create your own circulation with an open window, especially for Tutu and your grandparents and the people with immunocompromised. Blow the air away from them. Put the fans behind them or beside them. And I'll tell you, if you have another window open, they're not going to get anything. They're not going to have a problem. Or sit them outside with the trade winds at their back. And with the gusty trade winds we've had the last week or so, and with winter, we can beat this, guys. We can do well with this.
So with the, with the high, I guess, attachment to the oral or nasal mucosa, what
Mhm.
about tear ducts? Is that a danger? Is that a danger spot as well?
Um, it's going to be more of an issue with this new variant. So the use of masks in a setting where you might have high respiratory, droplets and mist around are probably a little more important. But again, I still think the nasal mucosa is going to be, and the orals more. But yes, eyes are probably going to be a little more important this time, Mel.
Okay,
Or
thank
Charlie, I'm sorry, Charlie.
Go ahead. Oh, you're muted, Mel.
I I know the CDC has already said they've discouraged travel. They have discouraged travel, especially during the holidays. But with this new variant, doesn't it make traveling in an aircraft even more dangerous? I know
Absolutely.
the industry keeps saying it's safe. It's safer than what they're crap. They can't. But with this new variant, and based on what you just said about the 8 feet, 10 feet, and the ease of this thing latching on, wouldn't that make air travel even more unsafe?
Uh, yeah, and guys, especially as a guy who's done, I don't know, man, I've done 150,000 miles. I mean, I had to go back and forth and flying all over the country, and so you can imagine. I've had my family, I've had everybody around me saying, be careful. And I think I might have said this on your show before, but what I do is I get on that plane and I have an N95. And I think we're not doing enough to get people to understand if they're available. And I don't want to take them from healthcare or first responders, but they're pretty ubiquitous now. That N95 is a big difference, followed by the surgical mask. But if at this stage with this new variant, I'm really recommending people to either use the blue surgical mask or an N95. If you're just going to play around with just putting your shirt up or something, you're asking for trouble. If you're going to be one of these people walking around like this with your nose out, why even bother wearing a mask? Because you're going to catch it and you're spreading it at the same time. So we need to pay attention to the mask we're wearing and also how those masks are fitting. There should be much more public service to discuss with the public what a proper fitting mask is like. And I don't see that anywhere in the United States. And I think we need to show people, like, for example, what we do on the front lines is we do what's called a fit test. And a fit test is where a trained individual has to basically look at an employee and test their mask and test. We even have these little hoods that go over that your mask is on, and then you put little droplets of like peppermint or something, and people should not be able to smell them. It's a standard testing device that it's used from OSHA across the board. So we do it more standardly because the other thing, guys, I'm proud to say, I have had 0 of 800 employees on the workplace get infected from being on a workplace. Some of them have gone on vacation and got infected and things, but you can do the right thing, just like the hospitals can do the same thing if you really have people that are trained in infection control and breathing it. And so I bring the long story up to tell the people what is very important, but at the same time, being on all these airplanes and being in line, oh my God, it's scary to think of how many people could be spreading it because they're not wearing the mask the right way. They flip their mask off. and they put a little bottle of water in front of them to say that they don't have to have a mask on because they're drinking something. Guys, I have my N95 off. I get a bottle of water. I pop it off halfway through the flight. I literally chug the bottle down in about 15 seconds. I put it down and my mask never leaves my face. I never take my mask off in that airplane. I might be overkill. I might be paranoid, but I don't care about eating. I don't care about anything on that airplane. So you can, but I would only do it with the proper mask and the proper fitting. Then the other thing that bothers me, guys, is that the airlines recently have pretty much unanimously dropped the concept that the middle seat is now empty, right? Before they were, not booking the middle seat and you would have, one or two seats in between. Now you go on these flights, full everywhere, every seat everywhere. So it's a big problem. I agree with you.
Now, with the schools, that's gonna shift a little, but keeping variant in mind. How, I see a lot of questions popping up about safe return to schools. I know right now there's, depending, every island has, and every superintendent has a different idea of a blended type schedule where they're going one day, next day they're online. What's your take on school children, school teachers with this variant? I just did a disinfecting not too long ago, and I saw the areas that needed to be disinfected, but thankfully, we were able to tackle it relatively quickly after, the report came out. So I'm just wondering, to answer the question of some of the viewers who thinks about schools a lot and their children, how safe it is. What's your take on that, Doc?
Well, I'm concerned with the new variant. If we find that the new variant becomes the predominant strain of COVID that starts going across the United States, I find it hard that schools will be able to remain open. It will mean that the schools are going to be extraordinarily contagious places. And I guess I can tell you it's all over the map what schools are doing right now. I mean, I'm working with Le Jardin Academy. We're working with Kamehameha Schools. We're working with other schools. DOE is, they don't work with anybody. They all huddle down and close everything out and make their own decisions. But a lot of the private schools are being very innovative. Their outdoor classes, the separations. I've been involved and asked to volunteer my time to give them recommendations, and I'm very impressed with what a lot of the private schools have done. And now, if I give you a broad recommendation, one of the things we've all heard Michael Mina out of Harvard, of his recommendation. And one of the things that he has recommended that all of us that are on the front lines of this would recommend, and whether it's employers or whatever, is the frequent antigen testing if possible. Now, the type of antigen testing we're doing could do it, but actually, one of the things I'm really impressed with, I'm working closely with the Terra group, which is the Israeli group that basically has founded the new approved breathalyzer. And so you basically do 2 big breaths in and out through what looks like a little e-cigarette into a breathalyzer. That thing comes out and pops the cartridge, and it's giving us a rapid, low-cost antigen testing. I would love for Monday, Wednesday, Friday, every kid to be able to have one of those tests done to see if they're infected or not. Because if you're negative on Tuesday, if you're negative Monday, negative Tuesday, and positive Wednesday, guess what? The antigen detects when you're shedding and you can spread it. You have just saved everyone right there. That's what rapid antigen does. And those tests, we're probably going to be able to, it's still not cheap, but that's probably going to be able to be done for maybe 12 to 15 bucks, So relative to what it means, relative to a budget, if you talk about maybe $100 a month for 3 or 4 months, I know there's a lot of kids out there, but for God's sake, this is COVID. 5 hospitalizations and God forbid 1 death, would pay for this over and over and over again. But I think that is one of the models that we should be looking at which is the more rapid but accurate low-cost antigen testing to predict and find the transition from shedding to non-shedding as fast as possible. Now, other than that, I can't see any safe way of opening a school without having some form of testing to identify where there's positives. And the other problem is that you guys know this very well since you're students of it. The number of asymptomatic children, they're really high. I mean, it's 40, 50%. The kids are going to be asymptomatic. And you're going to pop in there and you're going to have 20, 30 kids in this room and 15, 20 in this room. And then by that time, guess what? Boom, boom, with this new contagious 70%, now it's in the families. Now it's spread. So, and President Biden, President-elect Biden, basically has said in his first 100 days, he wants to have the majority of children back in school. So I applaud him for that. But there's got to be a big plan for it. And, my recommendation is if we're serious about that, the feds need to pony up, throw some money at it to get our kids safely back in school. So.
How far along are we? I know you mentioned earlier that the Department of Health, as far as testing for the variant, doing the sequencing for the variant, that we're going to do it on our own. But how effective, how capable are we as a state to do any level of effective sequencing to determine, how prevalent the virus or the variant might be here in our state?
Totally. This is not, they have enough access to what they need to be able to do it this week, so I have confidence in their ability to the ability to do genetic sequencing. It sounds big, but the equipment needed to do it, we've been set up with it. I feel confident with the leadership that we have now that we're going to be able to identify it. I feel good about it.
So we should know. I mean, it'd be crazy not to believe we have the variant here, based on what, it's in Southern California and the amount of travelers we get coming over. But how does that work? You got to find the right person, the right positive test that has the variant. I mean, how many tests are we going to test for the variant?
Well, I think that this is where the epidemiology comes in. So we're going to be doing like 75 tests, I think, this week. And so if you look at the total number of tests that are done and you figure out what 75, there's a reason 75 is chosen, because it becomes an appropriate number to do surveillance on. And in an epidemiology setting, I mean, you could try to target the people that are coming from specific locations, like now it's Florida, but that's going to be kind of doing like a little whack-a-mole. So more than likely, they're just going to do a randomized surveillance, probably with randomization from each island and each location. And then if you really look at the way the statistics work, that statistically, if you have 0 for the first week, well, then there's probably like a 98% chance you have 0. It's not perfect science, but each week we'll get further along in understanding the chances that it's present here or not. It's all statistics. In a perfect world, would do them all. Like in the UK, they're doing half of them. 50% of every test is being sequenced now.
Well, because it's blowing up, and I think, but I think to not target the areas that the virus or the variant has been found, because you could go do 75 tests and not test or not check any Southern California or Colorado or Florida.
I concur, and we'll have to ask that to the people who are driving this over at DOH. All I can tell you is, from what I understand, from what I heard and read, I feel pretty good about what they're setting off to do. Is it a perfect world? In a perfect world, I would agree with you. You'd start doing targeted testing of some of those places that those people are coming from, and maybe they are. I just don't have enough detail to know. But you are correct in your assessment.
Well, I'm really concerned that once that variant virus is here, then, like you mentioned, in the household, at the workplace, asymptomatic person carrying the variant, oh my Lord, just think of how how devastating that could be. That's horrific.
Well,
But then the positive side is you would definitely find a variant at that point.
well, but again, guys, I want to just say, what is the answer? Do what we're doing, but even more with more attention. Do it even more. Let's get some more public service out for the things that are going to prevent it. Because let's face it, right now it's the masks and wearing the right masks and having your masks fit, and the separation of the, maybe I would say 8 feet in my mind, or even more, avoiding those closed indoor environments. And then, of course, the hand hygiene, and then getting tested. Test, and test. And I'm not saying it because I'm out there leading testing, because we're doing vaccines, we're doing so many different things. But that's how we're going to find it. How do we stop cluster? Because it's even going to be more imperative to do rapid testing because of the fact it's more contagious. Because as soon as we find a positive, gosh, you don't do your contact tracing. You got to isolate. You got to do a 1st and 2nd degree contact tracing and testing of those people. And then you keep it up again and again. The next 3 months, testing in combination with the things we know are the only way we're going to stop this variant from going crazy. We're not going to stop it from getting here, in my opinion. It's probably going to be here, but can we stop it from being the #1 genetic variant that spreads between now and February? Sure, maybe it won't be till April till it's more, and that will be great, because hopefully we're already on the downside. So yeah, it's still the standard things that's going to make us safe.
One thing that I'm fearful of, and that is to take a look at this variant and how it reacts to those who have been vaccinated. The question came up before, and the way I understood it is, once you get vaccinated, you're protected, but your vaccination does not kill off if you should come in contact with someone, if you could be like a carrier, because your symptoms will be minimized with the vaccination, correct?
Correct.
So
Correct.
you become a walking asymptomatic person, and then you can be doing the old handoff unknowingly. So I guess everything is, make sure you got your mask, make sure you go your distance, so you don't run into that situation, right?
Yeah. Charlie, I'd like to use this analogy because so many people are asking me. It's a #1 question. They're like, wait a second, why do I still have to wear a mask or do all these things even if I've had the vaccine? And as I try to keep, without getting too technical, putting it to a way that people understand. I came up with this one, and almost everybody I said it to, they go, oh yeah, I get it. All right. So think of that little COVID virus. Now I want you to think of watching either Mel, and I love your photos of your wife's scones and all that good food, man. I was gonna ask for that to be sent. Come on, send me some of that. But think about yeast, right? So you take some yeast and it's in the water and you're sitting it there and you want it to start, activating before you want to maybe bake something. And I think a lot of people have seen that, how it just starts to fuzz and, it starts to spread. And next thing you know, you're looking in there, you're like, whoa. Well, now think about, with that yeast analogy in mind, you get a COVID virus in your mouth, and that little COVID virus goes boom, 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 and it starts spreading all over, and it's replicating like crazy, because remember, this thing is really active right now. Well, how do you go from that in your mouth and nose to being in an ICU on a ventilator? Well, what happens is that little virus then enters in your system. Enough of them replicate. They get in your bloodstream. They get through your bloodstream. They get in your mouth. They get down into your lungs. They start destroying your lung tissue. So now let's talk about a person with a vaccine. You've got the yeast in your mouth. Your mouth has got a bunch of yeast in it. But guess what? As each of those little yeasts try to penetrate through your skin, the Marines are there. They're waiting for them. And they're saying, get the hell out of here. And they start attacking them. And they start attacking them from entering your body systemically. but they still may be in your mouth. They still may be in your nose. They still may be replicating, trying to do something, but they just, and some of them may have successfully passed by the Marines, but guess what? Now you have the Army back there and they're cruising and they're knocking them up. You might get a little mild ache, you might get something, but guess what? You're not going to sick. You might not even know it. So, but you still have the potential to have some of those things available that, if you go and kiss tutu, you might spread it, right? So that's why you still got to wear your mask and be careful. I don't know, does that make sense, guys? Does that help a little bit?
That totally makes sense. And my last question to you is, not every county has a benefactor like the Big Island has had to, and the challenge that you've taken on. Um, do you think, based on where we're starting, or where we're at this point, going forward, now with the variant, is coming at an inopportune time? Because if it starts to take off, we'll need more testing than ever, right? That's one. Two, we just won't have the finances to do it. I just can't see where the financing is coming from. And then, I know the governor and lieutenant governor don't want to taxi they don't want to taxi out the traveler from paying for this test, but there's not going to be any other way of getting around it. I mean, that's the only way the test can be done.
Okay, guys, one of the things, reach out to Brian Schatz's office, and because in the information I've received from them, in the bill that was just passed, about $150 million will be allocated to Hawaii that will be geared towards testing, and it could be contact tracing. The state has the determination. So if you do the allocation, that means what? 15 million goes to the Big Island, 15 million goes to Maui, 10 million goes to Kauai, and the rest stays on Oahu if you do a population based or something. And then I think once we get the Biden administration in, he has made it crystal clear that he knows that testing has to be beefed up, because if you look at where we are with testing, we're way, way lower than we should be. So I think most of us are counting on the fact that there will be a recoup of some of this funding coming in to help us, because I mean, God forbid if the wells are dry and there's no replenishment of what it takes to do testing, because you're right. I mean, my benefactor ability is done. After I can't do anything more than I'm doing it this month. I mean, it's, we've got to cover this, but I think there is help on the way.
Thank you.
Yeah, unfortunately, it doesn't last, and the sustainability of the federal monies just don't last. I mean, especially when you're a small population like Hawaii. But the bottom line is you let the tourists pay. You let the tourists pay. It's an additional cost. I don't know why our state leadership is so anti-charging. That really pisses me off when I hear the governor say and the lieutenant governor say, we're not going to support anything that further inconveniences or further restricts our visitors. At some point, taxpayers should not, whether it's federal money or state, local, whatever, we should not be paying for a vacation or the opportunity for these people to get out of quarantine. I'm sorry. I think that's bullshit. I think that's wrong. If I go to Vegas, which I love to go to Vegas, and I want to participate in driving a car, I pay a local fee, a county fee, a state fee, a airport fee, a this fee, a that fee. It's a choice. If I don't want to, then I don't go. I find another place. And $20, $30, $40, seriously, especially now when the airfares are so cheap, the $40, $50 extra is not going to deter a visitor from coming to Hawaii.
I totally agree with you. And you highlighted the reason. The airfares are cheap. And guess what? Even though our hotels have been hammered, they're still offering a lot of great deals. There's incredible deals. The net to the visitor is going to be not that high relative to what the benefit is. And that's the big thing is, I said this before, I don't know, 5, 6 months ago when we were doing really well with our initial testing and the initial work we did, we need to be advertising ourselves as the safest place in the world. You want to come to the safest place? Guess what? There's a premium. There's a little bit extra money you're going to pay if you want to come to the safest place in the planet, safest place in the United States for sure, relative to the rest of the world suffering from a pandemic. So I'm with you guys, totally
Yeah,
with you.
and I also think the airlines should be charging their passengers, and everybody that comes in gets a mask that they got to wear.
Yep.
Period. And
Yeah.
you know, unfortunately, you cannot let out a passenger over the Pacific Ocean, but it is what it is. I mean, I think we're gonna. I'm concerned about our numbers. I saw our numbers. It's climbing again. I'm concerned. Kauai had 5 today, all travel related. I'm concerned, and I think, like you said, Doc, the worst is yet to come. And I mean, that hour went by really quick. So I did want to ask you to share the importance, and you did a great job tonight sharing the yeast example. But we have been pounding and over and over and over for our viewers to wear your mask, social distance, stay away from gatherings, wash your hands. But now more than ever, Doc, maybe you can pound it in a different way. I don't know.
Yeah, I mean, everybody, I keep saying the mask, the proper fitting of your mask. When you put that mask over, you could hold, what I encourage people to do is hold it over and then breathe in and breathe out through your nose. And I want you to see if the mask pops in and out right here. That tells you that you're creating enough suction that your air that is coming in and out of your nose is filtering out through the mask. If you're breathing through your nose in your mask and your mask is just hanging out and you can feel it coming up to your eyes and making your glasses go foggy or you know, feel it coming out here, or you feel this, you are still breathing other people's air and they're breathing your air coming in. So a proper fitting mask and learning how to wear one of those masks is very, very important. And then secondarily, guess what? If you're 10 feet away and you got some wind blowing and you're staying and you just pass by, you don't have anything to worry about, right? It's common sense, people, common sense. Sitting in a closed group environment with low ventilation and no air moving is asking to get the disease. So any environment you go in where there is no ventilation that's either natural or artificial that is going on, and you're in there for a prolonged period and other people's, you know, breath is in there and air is in there, you are at higher risk. If you're sitting out in the yard, pauhana, and you really do a nice job of spreading your chairs out 8 or 10 feet, God bless you, because guess what? Your chances are really, really low, you know? So common sense, a car, come on, you know? If we see a car where there's people in there with a bunch of masks off and you don't have your windows down, I think you're asking for trouble. But hey, let's start going to the old days. Let's start, you know, putting that arm out the window and letting the good old fresh air coming in when you have, even if it's your family and you're driving, let the circulation come in, because a car is another very challenging place where you could spread it. So those are a few of my hints, and I can't say enough about the circulation with our elderly. And I've even said this on national TV, in the winter they can't do these things, but if you put those fans up, you open a door to another room and then put a small window crack with another fan, and you create an internal ventilation. And then you do stadium seating. So say I'm sitting here and I'm 2-2, and you have people lined up over here, 10 feet this way, 10 feet this way, with a gap right down the middle, then you're pushing all the air out. So there's some common sense factors about the way the air moves that can really help people. But, you know, hand hygiene is important. But the other thing about your hands is pay attention, you know, don't be a pain in the butt. But if you see that someone has a habit, which a lot of people have, and they're always doing this and they're always rubbing their nose or something, gently remind them. That's how you could have your hands coated with COVID, but unless you put them to a mucosa, you're not going to get them. So it's the move to get the hands to the mucosa that is where the danger comes. So be a kind neighbor or friend or family member and tell people if they're putting their hands up to their face too much. So I could go on, but that's a start without being a pain in the ass. So.
Charles, any closing comments, Charles?
No, thank you very much, Doc. I mean, I think one thing that, well, I did a post today. I think, we all understand what the safety measures that we must take. But when you got people blowing fireworks, that's totally illegal. That kind of tells you their what they think about safety. That's already a red flag right there. So I thank you very much for your candor and your honesty, and that's what we wanted. We wanted to find out about this variant. I know we could go on more about that, but as the weeks and months go by and this variant starts to do what it's going to do, we get a better picture on how we have to take. Maybe it may be where we're going to have to wear double masks. Who knows? Or we're going to have to wear face shields at all times. We don't know yet. It's just you just got to wait and see. But hopefully, we got enough people vaccinated that at least they can shoulder the brunt of the of the variant a little better instead of trying to take it head on. And to our viewers out there, thank you very much for all the questions. We tried to get to some of them tonight. We talked about the schools. I know one viewer asked about asking a doc what his thoughts were for Maui to opt out of the Safe Travel program. I think that'll be too premature at this time, only because with the Maui outbreak, from what I understand, especially with Harbor Lights and all of that, and that's my old patrol ground, so I know that area very, very well. It's a community-based problem, and I don't think right now it'll be a good thing to do. But I think they got to do something. They got to do something. And we thank you for sticking by tonight. We went a little bit over time, but I want to thank the good doc for making his time available so he can share his thoughts with all of you. Thank you. Mel?
So guys, just so you know, along those lines, I did have a text, a reach out from Mayor Victorino, and I put a shout out to my contact with Dr. Pang over there in Department of Health, and I offered all of Premier services if we can help them, because what they really need is they really need targeted testing. They really need a lot of cadence testing. Again, I'm not bragging, but if you look at the model we set up on the Big Island, that's all you need to do. I mean, it's very comprehensive, but you need to have regular testing throughout your island. And I have to be honest, guys, I don't know what Kauai is doing. I don't know if they have, 3 points of regular testing 2 times a week, which you guys would know. It's west side and central, and then down in the Princeville side, north side, and minimum. And then anywhere where there's an outbreak, you need to be going in there, and you need to be doing every 3 days, and you need to do broad surveillance of and broad testing of any of those contacts. Anybody's been exposed to them. And then you should be in your public housing, you should be in your homeless facilities, you should be in the nursing homes. They should be just being tested a couple times a week on a regular basis, just constantly. They should be tested. And then there should be easy availability for, like, if there's a little community that starts to have symptoms, where you just need to go and take care of that community. That's the only way you're going to get this. And Kauai's small enough and unified enough, and you've got a great leader and your mayor. I think you guys could do that over there. So.
Roger Dodger. Yeah, I mean, I think, the mayor has made testing available once a week for anyone that wants it. It all comes down to the ability to pay, to fund these testings. We don't have, we have Zuckerberg's on this island. You would think he would drop a few million or a billion or whatever to keep his island safe, but that just doesn't happen. It hasn't happened. As far as he has made some contributions, but we have a lot of wealth on this island, and I wish that some of them would put a little more into the cause so we can keep our island safe. But
Yeah.
we do the best with what we got. And I know one thing though, and this is what is undisputed. And again, I spoke of it earlier, is why Kauai is different from the other islands. I have no clue. but the numbers don't lie. And the October 15th started a horrible pattern for Kauai. And I agree with the mayor's actions, because if he didn't do anything, I think we only have 9 ICU beds here, Doc, and I think you can appreciate the danger of that. Just 9. I mean, that's insane. But it is what it is, and that's what we got.
Yeah.
So as always, we appreciate you coming on and spending your time with us and breaking things down so even Charlie and I can understand. It makes it so much easier.
Come on, guys, you're my heroes. You guys, don't say that, Mel. You guys, and again, congrats to you guys. I mean, even with where I was all over, and I'm traveling all over, and I'm in 15 different states. I mean, I'm still following what you're doing. I still get your posts, and I was reading every single thing on Facebook, and I'd still pop in and out of watching your shows. That you guys are heroes, man. I mean, no, but seriously, at the end of this, there are going to be certain people that you're going to look back and talk about the contribution that they made. And you guys are way on the top of my list for people.
Oh, gosh.
Thank you for making a contribution of what do we need, guys? Truth. We need honest truth. We need, because you know what? People of Hawaii are smart. The people of Hawaii know when you're telling the truth or when you're not telling the truth, very much so in your island. And there's never a question when you guys are out here that you're telling it as it is. And that's what people need to know. There's so many darn talking heads, and there's so many blah, blah, blah political people speaking from whatever their position is. We don't need that now. I don't care if you're strong blue or strong red or what you believe in. This is not a political event. This is the worst pandemic this planet has seen probably in a millennia, and lives are being lost, and we got to stop it as a community that cares for each other. And you guys are leading the charge, man.
Okay, I'll have my wife make you some scones. All right, I'll have my wife make you
blueberry,
some scones.
please.
Yes, it's blueberries. That's what she's making right now, actually.
Yeah. I think
anyway,
I smell them. I do. I know.
Yeah, boy.
Wind's blowing this way, man.
We never had blueberries in our house since we've been married, and all that. What the hell is blueberries? I don't, she, I'm gonna try to make some scones, and man, delicious. I gotta tell you, right out of the oven. Ooh. Anyway, thanks for the kind words. We appreciate you coming on, and we'll be watching this thing. The variant. Don't be surprised. You get a call or text again from me asking you to come back on.
Yeah.
Like I said, I'm afraid of what's about to come. People got to understand that we got to do our part individually, and we can and will beat this damn thing. So.
Yeah. And guys, I'll be here. So reach out to me anytime. I'll be here. I mean, I've got a lot of things on the mainland going, but I've got great leadership, and it's going really well. And I'm focused on home. This is my home, and so between the program we have on the Big Island and some of the things we're expanding. Like right now, over the last 2 hours, I was just texted about another positive cluster in a nursing home, and I'm going to have a team in a nursing home tomorrow. And this has all happened since about 6:30 tonight. And that's what's going on. I have 2 or 3 teams that are going out immediately responding to these clusters, especially in the nursing homes. And we've been doing really well. I'm proud of what we've done with them. So.
You see, what we actually need, really, that's part of it right there, is have enough trained personnel that you can train them, put out enough strike teams on each island.
Yep.
Because, as former investigators, we know for a fact that if a case goes cold, you get a harder time trying to track down anyone involved with that case. The best time to catch them is within the first hour to 4 hours of when the case happens. I mean, that's your optimum. That's when you can really work it hard. Then the follow-ups can come after that, but you catch them hard in at least the first 6 hours, you're doing good. You're doing good.
I want all my strike teams, all my testing, like if I have a positive in a nursing home within 24 hours, I want every member, every resident, and every employee tested in 24 hours of the notification. And then we go on a cadence of every 3 days. And every 3 days, you go through that same cycle until you go through 14 days where you have no positives, and then you can effectively say the disease is no longer there. You can't shortcut it. It's the only way you're going to do that. I don't care if it's public housing. I don't care where it is or a homeless center. That's how you've got to do it to get rid of this disease. So.
No, that's I don't believe that's happening here, but you know, we can hope. We can hope. And anyway, one last question: who's going to win the NCAA championships?
Come on, man, roll tide. So I've become pretty close with everybody in the SEC, and so I've spent my fair share. I have to send you my videos because my goal, because I played receiver at Cornell, and my goal when I became the consultant to the SEC was that I was going to catch a football in the end zone of every SEC stadium. So I'll send you now it was the practice stadium, but I'll send you my videos of me catching football in a lot of the different SEC stadiums, throwing it with the players and throwing it around. So that was
Okay,
one of my highlights.
I'll appreciate the video, but I'd much rather have some autographed memorabilia from any of those players or the coach or whatever. But anyway.
Yeah. How about the letter? How about the letter I had to sign saying coach or player is released to play or has to be pulled out of the game?
Oh, yeah, I'll take one of those. I'll take one of those.
I have to sign every letter to do that. And it's a lot of pressure in a billion-dollar industry, but you know what? It doesn't matter. It's all about healthcare. It's all about healthcare. It doesn't matter to me. They're all human beings. And it's been a great group to work with. I really made great friends. And the leadership down there, it's been fabulous. The support from the doctors throughout, because we have a medical advisory group of one main provider from every SEC school, and we meet weekly, and top professionals. And it's never been about the sport. It's always about the people and the healthcare of all those student athletes. So I think that's why we just finished the season successfully. So.
All right, thank you for that, man.
Thanks,
At least we got to watch some football.
Yeah.
Thank you. Thank
Take
you.
care, guys. Anytime, man. You talk to me.
Helping, our referral, our own very own Hawaii Pacific University. I know they called you for some help, and then you gave them some advice on what needed to be done. One of the right behind Mel, the dad, Dallas Correa. I know you. Yeah. Father did that poster behind there.
Oh, really? Oh, yeah. Dallas is a great guy, and we're working closely with HPU to help them, safely get back. Yeah, we're doing a lot of testing, working with them. So, yeah. So, hey, no difference between HPU and Alabama from my standpoint, or University of Florida or Texas A&M. They're all the same. They're all athletes trying to go out there and play a sport they've devoted their life to. These kids, right?
All right. Well, thanks again. Thank you very much. You stay safe, Doc. You stay safe and keep doing the good work. People, will see you guys Monday night, 7 o'clock. You guys all have a great, safe weekend. Love you guys. God bless. Take care.
Aloha.